I think we have been doing a lot of work, meeting different stakeholders from African traditional medicine practitioners to clinic committees to hospital boards and even our officials from our facilities. So it's just a matter of preparing and actually engaging and also addressing the challenges or the issues and concerns that the stakeholders are raising. And every engagement comes up with a different insight and a different perspective on what an NHI is all about. But our preparations are far ahead. We are hoping to get overwhelming support on the bill and also to get the public to raise these issues that they are concerned about. Most of them, they are not pretty much fundamental. On principle, they do agree and support the concept of universal health coverage and how we want to roll it out. And there are just few things that we need to go as a country engage in a conversation on how to address them. The most important thing for us is that we have trying to to eradicate the word overburdened, because I think we've accepted our role as the center of our economy, center of our country. I think the Premier says that Gauteng is actually the heart of South Africa. But I think what NHI will do, it will make it easier for us to be able to access the general resources that are available and which will be cross-border as such. Because now currently the way we're doing things is that when we see patients from Mpumalanga or any other province, we need to bill them. But now with NHI, it might actually, in essence, take it that away, and it will make it easier for us to get the actual funding readily available for our actually functioning. The major challenge that we have, like I said, it's just the population. We've got 15.2 million people, and these are documented people. So we are estimating that with undocumented people, we will be around 16.5 million people. We actually treat or see almost 28 million visits per year, which is quite a huge number. So in terms of everything, we think that we need to get a bigger share of the human resource. We need to get a bigger share of the finances. But one of the things that we're also committed to do is that we also need the periphery or the other parts of the provinces to be developed, like your Northwest and particularly the immediate ones. So with our medical schools and our central hospitals, we do a lot of outreach to Mpumalanga, to Limpopo, and to Northwest, just to be able to try and cover their ground and offer them assistance. And it's something that we are doing quite well so far. Hopefully with the introduction of NHI, it will make it easier for a better collaboration and partnerships going forward. No, it's a public document on the pilot sites. We only had one. I think you'd remember that KZN had two. But in the one pilot that we have done, we actually able to reach a couple of clinics to be ideal clinics in terms of the standards that were set. And there are a few lessons that we've got from them. One of them is the issue of how would want to perfect the contracting of medical practitioners who will work into the system. That's one. The other one is just the national registration, patient registration system, which is important for us to be able to identify. All citizens must have a unique identifier. The other one is on just the issues of staff norming, like staffing norms that were there. And there are a lot of lessons that we've received. And the other one, which is quite important, which we are in the process of implementing, is the one on community healthcare workers, because they are becoming an important part of the wheel that will turn the healthcare system in terms of strengthening primary healthcare. So just for us integrating them and formalizing them into the formal cohort of healthcare workers becomes an important aspect to it, and we are moving on that. And this is one of the lessons that we actually we learned from the pilots that are there. The other one is just the issue of task shifting that has happened in terms of clinical associates, which are not necessarily doctors or nurses, but they work under supervision of medical practitioners, and they're able to do minor procedures and they can alleviate. So there are a number of things that we've learned from the pilot. I think it's an unfair reaction from people who maybe don't want or fear of engaging, because I don't think there is a lack of space for engagement. The platform is open, and I think the issue is for them to be able to engage and raise their concerns on what is it. But what we have said, that the issue of immigration, it's an urban-rural type of discussion. So immigration is an emotive thing. But just to say that we encourage them not to go, I think we have space for them to raise their concerns and issues that they want to be, mainly that they are concerned of. So we can't live on fear. We are open for engagement, but we are confident that the way we're going to implement NHI will be a South African model, and it will be a consensus model. We know there are things that we want a compromise on the principles, but there are things that we need as a society to deal with, in particular the issue of corruption, which is a major thing that will be affecting us. But I think if we work together, put up systems, learning from all what we've been watching on Zondo Commission, the PIC Commission and everything, I'm certain that we can put proper governance systems that will make sure that we don't get into a problem or a state where corruption just collapses the fund.